Hi, my name is Mary Alman, and today I'll be presenting on the most prevalent diseases in Chile. So the three most prevalent chronic diseases are cardiovascular disease, which causes more than a quarter of all deaths, approximately 30,000 per year. Diarrheal diseases, these affect 19 out of 100,000 people. This rate should be much lower for a developed country, and what they really need is clean water and food, free from bacteria and pollution. And the third is cancer, which causes 26% of all deaths in Chile, the most common of which being gastric cancer, which is higher in Chile than anywhere else except for East Asia. However, today I will not be focusing on the chronic diseases so much as the infectious diseases, two of the more prevalent ones being HIV and tuberculosis. So, HIV affects 23 out of 100,000 of the population, and the age-adjusted mortality rate is 2.5 out of 100,000 people, which significantly decreased by 17.1% from over the course of 2000 to 2019. The higher HIV and AIDS prevalence rates were up here in the northern regions of Arica and Parinacota, and in the more southern municipalities of and regions of Valparaiso and Santiago. All of these have a greater prevalence than the average of the whole country, which is about 3 out of 100,000. HIV is highest in people of ages 30 to 49 years old, and then very close behind is 15 to 29 years old. The other one is tuberculosis, which affects 13 out of 100,000 of the population. Age-adjusted mortality rates for women and men respectively are 1.5 and 2.2. The morbidity rate for tuberculosis has increased in 9 out of the 15 regions of Chile that were monitored in the study from 2014 to 2017. Tuberculosis has more of a lower prevalence, but it is concentrated in these risk groups, which the co-infection rates for each have increased significantly in the last 6 years. HIV and AIDS increased by 68%, immigrants increased 118%, in drug users and alcoholics it increased 67%, and in the homeless it increased by 370%. So I'd like to talk more about the TB and HIV co-infection in Chile. In 2017, the WHO found that in the Americans that 36 million people lived with tuberculosis, which caused approximately 1.3 million deaths among HIV-negative persons and more than 300,000 deaths among HIV-positive persons. 11.4 of tuberculosis patients in Chile have a positive HIV test, and the mortality for TB-HIV is 25%. In a study that was done out of 17,512 people, 87.6 of people who tested positive for both HIV and TB were men. If you are HIV positive, you are 21 times more likely to develop active tuberculosis, and tuberculosis prevalence in HIV and AIDS patients follows regional TB prevalence. However, diagnosis of TB and HIV positive persons is limited because of poor infrastructure, and unaddressed issues of culture delays starts of antiretroviral therapy and multi-drug resistant tuberculosis. Several risk factors for HIV/TB are low T cell count, smoking, which 12% of deaths in Chile are caused by tobacco use each year, intravenous drug use, unemployment. See the graph for the employment rate total for people from 15 to 64 years old. From 2006 to about 2022, you can see it kind of hovering right there in the 63% range, and then had a big dip in 2020, and then is finally climbing back up. Although this is a pretty big age range, and it covers the totality of Chile instead of focusing on municipalities or more rural area regions. You can imagine that, as seen by this average, in some places the employment rate can probably be pretty low. Other risk factors are MSM, lower education levels, specifically not above high school level, having other opportunistic infections, and having a history of tuberculosis or HIV. Now to talk a little bit about antiretroviral therapy, it has increased life expectancy for people with HIV and AIDS by 10 years. People with HIV/TB who are in ART have a higher risk of dying, however, and people with HIV/TB have a shorter survival time comparatively to other ART people with different pathologies as co-infections. In Chile, there has been seen to be an increased infection in the Aymara and Mapuche indigenous populations, because the indigenous populations have been found to enter treatment later than other Chileans and experience higher morbidity and earlier mortality because of this. There's also been shown to be an increased infection in women, and urban areas have more people in ART and better health care than rural areas, thus lowering mortality rates. Also, stigma prevents people from getting tested or treated, and thus poses a very large barrier to reducing incidence of disease. Having high school, as mentioned before, having a high school or higher education is a protective factor for mortality for co-infection, and large differences in educational attainment, which have been shown in urban versus rural areas of Chile or just different regions, lead not only greater mortality, but also greater inequality. And there are high levels of income inequality in Chile, which makes it an economically vulnerable society and causes large disparities in healthcare as well. There's also lower sanitation in some places, and there's no prevention programs targeting disadvantaged groups. Some solutions are to improve community-focused testing for HIV and tuberculosis, and providing the resources for that. Also, implementing sex ed and structural interventions in indigenous and minority cultures to reduce adult mortality, and implementing social policies protecting human rights of vulnerable populations, and of course overall investment in the healthcare system and HIV/TB procedure in Chile. These are my sources, and thank you for watching.